If you are taking medication for Parkinson's disease, please stop what you are doing and watch this video until the end, because what I'm about to share with you could literally save your life or the life of someone you love. Here is something most people do not know. Every single morning, millions of Americans over the age of 65 take their Parkinson's medication with breakfast. They swallow their pills alongside a glass of protein shake, or a bowl of high-protein eggs, or even a simple cup of coffee. And they have absolutely no idea that what is sitting right there on their breakfast table could be quietly making their medication stop working, or worse, pushing it to dangerous levels inside their body. Drug interactions with Parkinson's medications are one of the most underreported and misunderstood dangers in elder healthcare today. And the scary part is, many of these interactions do not come from exotic or rare substances. They come from everyday things, common foods, common medications that your doctor may have prescribed you for a completely different condition, things you would never think twice about. Today we are going to walk through 5 of the most dangerous drug combinations that anyone taking Parkinson's medications absolutely needs to know about. I will explain exactly what happens inside your body when these things mix, what warning signs to look out for, and most importantly, what you can do to protect yourself. So, let us get into it. Number 1. High-protein foods and levodopa, the breakfast trap that millions fall into. The most commonly prescribed medication for Parkinson's disease is a drug that works by converting into dopamine inside your brain. Dopamine is the chemical messenger that controls movement, and in Parkinson's disease, the brain gradually loses its ability to produce enough of it. This medication has been helping Parkinson's patients for decades. It's truly one of medicine's great success stories. But here's the problem nobody talks about. This medication has to compete with protein to get into your brain. Both the drug and the amino acids from protein use the exact same transport system to cross from your bloodstream into your brain. It's like two people trying to squeeze through the same narrow doorway at the same time. One of them is going to lose. And most of the time, when you eat a high-protein meal right before or after taking your Parkinson's medication, the protein wins. The amino acids flood your system and block the medication from reaching your brain in the amounts it needs. The result? The medication simply doesn't work as well. Patients experience what doctors call off periods, where their symptoms come back stronger. Tremors return, movement becomes stiff and slow, balance gets worse. Now, here's what I want you to really think about. Protein is not bad. Your body absolutely needs it. And for older adults especially, adequate protein is critical for maintaining muscle mass and overall strength. So the answer is not to stop eating protein. The answer is about timing. Most movement disorder specialists recommend taking this medication either 30 to 60 minutes before a meal, or at least 1 to 2 hours after eating. This gives the medication time to absorb before protein from food enters your system. Some patients do better eating smaller amounts of protein spread throughout the day, rather than large protein-heavy meals all at once. I want to ask you something right now. If you or someone you care for is taking this medication, have you ever talked to your doctor about the timing of meals and doses? Drop a yes or a no in the comments. You might be surprised how many people have never had this conversation. Number 2. Iron supplements, the hidden blocker hiding in your vitamin cabinet. Many older adults take iron supplements, and there are very good reasons for this. Iron deficiency anemia is common in seniors, and a doctor may prescribe an iron supplement, or you may pick one up at the pharmacy as part of a daily vitamin routine. It seems completely harmless. After all, it is just a mineral your body needs. But if you are also taking medication for Parkinson's disease, iron can create a serious problem that very few people are warned about. When iron and certain Parkinson's medications are taken close together, the iron physically binds to the medication in your digestive tract. Think of iron like a magnet and the Parkinson's drug like a small metal particle. They attach to each other, and when that happens, your body cannot absorb the medication properly. Studies have shown that taking iron at the same time as some Parkinson's medication can reduce the absorption of that medication by as much as 50 to 75%. That is an enormous drop. Now, think about what that means in practice. If your medication is barely getting into your bloodstream, it cannot get to your brain. And if it cannot get to your brain, it cannot do its job. Your symptoms can worsen dramatically. And your doctor, who is monitoring your condition, may think your disease is progressing faster than it actually is, when in reality, the medication just isn't being absorbed. The fix is also about timing and awareness. Most specialists recommend separating iron supplements from Parkinson's medication by at least 2 hours, 2 hours before or 2 hours after. That simple gap can make a dramatic difference in how well your medication works. Please check your vitamin cabinet right now. If you are taking a multivitamin, read the label and see if it contains iron. Many multivitamins for seniors contain significant amounts of iron, and most people do not realize this. Talk to your pharmacist or your doctor about the best time to take your supplements versus your medication. Number 3. Antipsychotic medications, when one prescription fights another. This next one is particularly important because it involves a scenario that is extremely common among older adults with Parkinson's disease. Here's how it often plays out. Someone is living with Parkinson's for several years. Over time, they begin to experience hallucinations. This is actually a recognized symptom in some Parkinson's patients, especially as the disease progresses or as a side effect of certain Parkinson's medications. The hallucinations are frightening, the family is concerned, the patient sees a doctor, possibly even a different doctor than the one managing their Parkinson's. That doctor, trying to help, prescribes an antipsychotic medication to control the hallucinations. And in many cases, this makes everything dramatically worse. Here's why. Most traditional antipsychotic medications work by blocking dopamine receptors in the brain. But in Parkinson's disease, the entire problem is that there's not enough dopamine activity. These two things are working in completely opposite directions. Giving a Parkinson's patient a dopamine-blocking antipsychotic is like trying to fix a leaking pipe by turning off the water supply completely. You may solve one problem while making the underlying condition catastrophically worse. Patients who receive the wrong antipsychotic medication can experience a sudden and severe worsening of their Parkinson's symptoms. We're talking about profound rigidity, the inability to move, severe tremors, and in some cases, a dangerous condition that can be life-threatening. Now, I want to be very clear here. This does not mean that Parkinson's patients can never be treated for hallucinations or psychosis. There are specific medications that are considered much safer for people with Parkinson's, and a specialist can guide you on those options. The danger is when general practitioners or emergency room doctors prescribe traditional antipsychotics without knowing about the Parkinson's diagnosis or without knowing which class of medication is safe. If you or a loved one with Parkinson's is ever prescribed a new medication for psychiatric symptoms, please make sure the prescribing doctor knows about every single medication already being taken, and ideally consult with a movement disorder specialist before starting anything new. Has this kind of situation ever happened to you or someone in your family where different doctors prescribed things that conflicted? Let me know in the comments, because you're definitely not alone. Number 4. Certain blood pressure medications, when your heart medication trips your body up. Many older adults are managing multiple conditions at once. Parkinson's disease alongside high blood pressure is an extremely common combination, and so it is very likely that someone taking Parkinson's medication is also taking medication to control their blood pressure. For the most part, this can be managed safely, but there are specific situations where the interaction becomes dangerous. Parkinson's disease itself can cause a condition called orthostatic hypotension. This is a drop in blood pressure that happens when you stand up from a sitting or lying position. It causes dizziness, lightheadedness, and in some cases fainting. It is one of the leading causes of dangerous falls in older adults with Parkinson's. Now, when you add certain blood pressure lowering medications on top of this, you can take an already risky situation and make it significantly worse. The blood pressure medication does exactly what it is supposed to do. It lowers blood pressure. But in a Parkinson's patient who already has difficulty regulating blood pressure when changing positions, this can cause blood pressure to drop to dangerously low levels at exactly the wrong moment. Picture this. Someone gets up in the morning, moves from lying down to sitting, then stands up to go to the bathroom. Their blood pressure crashes, their legs give out, they fall. And for an older adult, a fall can mean a broken hip, a head injury, or worse. There is also another specific interaction worth knowing about. Certain older antidepressants, when combined with the main class of Parkinson's drugs, can trigger a situation where blood pressure suddenly shoots dangerously high. This can put extreme stress on the heart and the blood vessels. The message here is not to stop taking your blood pressure medication. Your heart health matters enormously, but your entire medical team needs to know everything you are taking, and your blood pressure should be monitored regularly, including when you are changing positions. Ask your doctor about the best way to check your blood pressure at home, and let them know immediately if you feel dizzy or lightheaded when you stand up. Number 5. Certain antibiotic medications, the infection treatment that can backfire. This last one surprises almost everyone who hears it, and that is exactly why it is so important. Antibiotics are one of the most prescribed classes of medications in the world. When you get a urinary tract infection, a respiratory infection, or a skin infection, antibiotics are often part of the treatment. And for older adults, infections are more common and more serious, so the need for antibiotics comes up regularly. But there is a specific group of antibiotics that carries a meaningful interaction risk with Parkinson's medications. This group works in a way that can affect how the body processes other drugs. Specifically, some of these antibiotics can interfere with the enzyme systems in the liver that are responsible for breaking down and clearing medications from the body. When this enzyme system is affected, Parkinson's medications can accumulate to higher levels in the blood than intended. This can cause side effects that look like overdose symptoms, uncontrollable movements, severe nausea, confusion, and heart rhythm irregularities in some cases. On the flip side, some antibiotics can actually reduce the effectiveness of Parkinson's medications by speeding up how quickly the drug is cleared from your body, leading to undertreatment of symptoms. Additionally, there is research suggesting that the gut plays a role in how certain Parkinson's medications are processed before they even reach the bloodstream. Because antibiotics affect the bacteria in your gut, a course of antibiotics can temporarily change how the medication behaves in your body. I want to be very clear again. If you have an infection, you need to treat it. Untreated infections in older adults are extremely dangerous. The point here is that when your doctor is choosing which antibiotic to prescribe, they need to know about your Parkinson's medications. This is a conversation that should happen before the prescription is written, and your pharmacist can also be an incredibly valuable resource in checking for potential interactions. What you should do right now. Before we wrap up, I want to give you something practical you can do today, not tomorrow, today. First, make a complete list of every single medication and supplement you take, and I mean everything. Prescription drugs, over-the-counter medications, vitamins, minerals, herbal supplements, all of it. Write down the name, the dose, and the time of day you take it. Second, bring that list to every single doctor you see, not just your neurologist, every doctor. Your cardiologist, your primary care physician, your urgent care doctor if you need to go. Every single one of them needs to see the full picture. Third, build a relationship with your pharmacist. Your pharmacist is one of the most underutilized resources in healthcare. They are trained specifically to check for drug interactions, and many pharmacies offer comprehensive medication reviews at no cost. This service exists exactly for situations like the ones we talked about today. Fourth, never stop taking your Parkinson's medication on your own. Even if you were experiencing side effects or you were worried about an interaction, please call your doctor before making any changes. Abruptly stopping certain Parkinson's medications can cause severe and even life-threatening reactions. And fifth, if you ever feel suddenly worse after starting a new medication, do not wait. Contact your doctor or go to urgent care. A sudden worsening of Parkinson's symptoms after starting something new is a signal that needs immediate attention. I want to leave you with this thought. Managing Parkinson's disease is complex. Managing it alongside other health conditions is even more complex. But you do not have to navigate it alone, and you do not have to figure it out just by trial and error. The information we talked about today is information your medical team should be discussing with you proactively. If this video helped you understand something you didn't know before, or if it made you think about a conversation you need to have with your doctor, please share it with someone else who might need to hear it. A family member, a neighbor, a friend who is living with Parkinson's. This kind of information has the power to prevent a very serious harm. And I want to hear from you. In the comments below, let me know, did you know about any of these interactions before watching this video? Or is there one in particular that surprised you the most? Your comments help other people in this community learn too, so please share your thoughts. Take care of yourself, stay informed, and we'll see you in the next one.